Welcome to Smart PT. My name is Jonathan Reimer. Today we're talking about high ankle sprain. Many of you have probably dealt with this in your clinic and know how frustrating it is to assess and treat. So today I'm going to give you a couple tips on what I like to do to assess and treat the high ankle sprain. So generally it's an injury to the anterior inferior tibiofibular ligament at the bottom of the syndesmosis. So they can be challenging to treat to get that stability back in that joint, as every time the client moves into a dorsiflexion position, there's a significant amount of stress that splays that joint and re-aggravates that ligament. So there's a lot of different tests for checking for a high ankle sprain. Basically, they all involve feeling the splay of the tibia and fibula, either when you're squatting or dorsiflexing the ankle. In my general assessment, I do like to do a forced dorsiflexion eversion of the ankle and to see if that produces or provokes pain. Sometimes I'll also do a tap on the heel. If I do get a positive there, I might suspect high ankle sprain is potentially occurring. But the test I like the most, because I feel a lot of the other tests aren't very sensitive and there's probably a lot of issues with inter-rater reliability there as well. So the test that I like the most is to bring the person into full ankle dorsiflexion and eversion, and then what you're going to do is you're going to try to pull the tibia and fibula forward. In this position, the talus should be fully engaged in a closed pack position in the mortise, so there shouldn't be any play at all. You should have a fairly firm, hard type end feel. There shouldn't be any anterior translation of the tibia and fibula. I find that one to be the most sensitive and reliable. If I feel a little bit of give there, I'm suspecting a high ankle sprain. So basically, what do you do to treat it? Of course, you can use all of your regular physiotherapy modalities and exercises, but the number one treatment that will be most successful for your client, I can almost guarantee success if the client is compliant, is to use 3 strips of tape at the distal tib-fib joint, okay? So you're gonna just go circumferentially around the distal tib-fib. 1, 2, sorry about there. And finally, 3. I've had athletes playing soccer and other sports with a high ankle sprain. With this treatment, they can stay pretty engaged in their sport. Basically, the key to success is the moment you step out of bed, actually don't even step out of bed, have the tape at bedside, you wrap it up before you get out of bed. The hard parts are there are often some skin and hair follicle irritation from taping it every day. The challenge is, and this is why it's so difficult, it's such an easy plan of care, but so difficult because the patient or the client needs to do this for about 6 weeks straight. They'll feel better at about 3 weeks, but if they stop, they're very likely to re-aggravate and start at square one again. So you really have to impress upon them that they have to do this treatment strategy for a full 6 weeks. That gives the ligament time to heal and to stiffen up, and I have found almost without fail that at the end of that 6 weeks, if the client was compliant, they're recovered fully from their high ankle sprain.